Welcome to the Psych and Business Podcast. We're here to show you how practical psychology can be useful and make your workplace better. I'm Dr. Ernest Wayde. So a couple of weeks ago, we were introduced to Blue Rivers Hospital in the story that we've been telling, and specifically Dr. Emily Carter, who is the new acting CEO. Now, after working through the service profit chain, which shows the relationship between employees and eventual organizational success and profit, Dr. Carter attempted to speak with the nurses. However, due to her own perceptions and focus, she did not clearly communicate her intentions to help the nurses, and her message had a negative impact on the nurses who responded defensively. So now Dr. Carter is committed to meeting with the nurses again to communicate in a way that is clearer and representative of their perception. Dr. Carter wants to ask for help in better understanding the nurse experience and their behavior. So let's get back into the story. Dr. Carter decided to get help from the Director of Human Resources in crafting her message to make sure it would resonate and have the intended impact. Specifically, Dr. Carter wanted to communicate to the nursing staff that nurses, specifically the nurse experience, satisfaction, and engagement were important to her as a physician and to the organization as a leader of the organization. She was committed to better understanding their experience and the impact their experience had on their behaviors. She wanted to work with the nurses to find solutions that would work for nurses and the organization as a whole. Essentially, she wanted to achieve a win-win. The Director of Human Resources, Ms. Ramirez, helped Dr. Carter craft a statement that she could use in her next meeting to express her points, and she also suggested engaging in a behavioral chain analysis exercise with the nurses to help dive deeper and enhance the understanding of the potential events and actions that were causing the nurses' behavior of absenteeism and high turnover. Dr. Carter was not familiar with this analysis, so she asked Ms. Ramirez to provide a little bit more information. Ms. Ramirez explained that the behavioral chain analysis is a method or a systematic approach that is used to analyze problematic behavior patterns by breaking them down into smaller components in the form of antecedents or starting points or triggers that lead to specific behaviors and have resulting consequences. You then examine the relationships between these components. Ms. Ramirez pointed out that Blue Rivers was once considered a great place to work and that staff behavior, specifically in this case, the behaviors of absenteeism and quitting, did not occur in isolation, but are rather interconnected results influenced by various factors. A careful analysis of staff behavior and triggering events was necessary to understand and eventually address the issues, kind of like a behavioral root cause analysis. And as Ms. Ramirez, who had been trained to use the behavioral chain analysis, to join her during the meeting with the nurses and help facilitate the conversation using this method of the behavioral chain analysis. During the second meeting with the nurses, Dr. Carter began by apologizing for her poor choice of words during the previous meeting. She stated that she had no intention of suggesting or implying that the nurses were the problem or at fault for the Blue Rivers problems. She shared that her intention was and is to communicate as a physician and as the organizational leader that she believes strongly that nurses, specifically the nurse experience, nurse satisfaction, and nurse engagement are important to Blue Rivers, and she wants to make sure that the nurses are receiving the support they need. She expressed her commitment to better understand the nurse experience and the impact their experiences over the last few years has led to behaviors like high turnover, high unplanned leave, less engagement, and communication issues that have been noticed among the nurses. She asks the nurses to work with her to find solutions that will work for the nurses and the organizations as a whole. The nurses are at first understandably skeptical, But once Dr. Carter turns the meeting over to Ms. Ramirez, and Ms. Ramirez engages the nurses asking questions in the behavioral chain analysis approach, specifically targeting quitting and high leave usage, the majority of the nurses begin to join the conversation. Dr. Carter observes the process and learns that the nurses are quitting Blue Rivers and taking higher unplanned leave because they are feeling stressed, frustrated, and unappreciated. The nurses state that these feelings have persisted since COVID. In further discussions, the nurses state that stress is not actually new and existed before COVID. However, they have not been able to adequately relieve stress, in part due to the lack of staffing, which requires them to work until they're exhausted. The nurses state that they're feeling frustrated and unappreciated because they felt like they no longer had a voice to give input into their work. When asked to explain further, the nurses stated prior to COVID, the nurses had been part of various hospital committees and boards where they were able to actually express their opinion and give input to various aspects of Blue Rivers. However, due to COVID, many of these committees and boards had shut down and either did not reopen or reformed to only include what was deemed to be essential personnel, which excluded the nurses, making them feel and believe that they were not thought of as essential. Additionally, when the nurse executive retired shortly after COVID began, the former CEO did not replace her in an attempt to save costs. Therefore, the nurses did not feel that anybody was advocating for them, such as when their flexible work schedules were removed. In a summary report to Dr. Carter, Ms. Ramirez surmised that the high turnover and absenteeism behaviors were linked to nurses feeling stressed, frustrated, and unappreciated. These feelings were linked to low staffing of nurses, loss of ability to give input, and lack of representation at the highest levels of leadership, which made nurses feel disempowered and resentful. The specific events that precipitated these feelings were the exclusion of nurses from committees and the lack of nurse leadership representation at the executive levels. And of course, COVID contributed to creating a vulnerable situation where people in general felt overwhelmed and unable to appropriately deal with everything that was going on around them. To try to fix things, the nurses stated that they would like the return of a nurse executive in the leadership team, the ability to give input into medical and other relevant matters at Blue Rivers as they had before, the return of flexibility in their work hours, and the hiring of more staff. Dr. Carter was grateful for this information as it gave her concrete places to start her efforts. She was not sure she could get everything the nurses wanted, but she knew that she had to speak with the Optima healthcare system leadership, who now had oversight and control over some of these issues. Dr. Carter resolved to set up a meeting with the CEO of Optima Health Systems as soon as possible. Okay, let's stop the story there. The behavioral chain analysis actually has its origins in psychology and is used a lot in mental health, but the principles are applicable in the workplace as well. Very often, even the people exhibiting problem behaviors don't always understand the consequences, the starting point, or the triggers of those behaviors, and can benefit from this sort of exercise to help them understand it better. It's also very helpful for organizational leadership as it pinpoints specific causes of behavior and can be helpful in developing solutions that should lead to a change in that behavior. Think through some of the behaviors you have shown at work when things are not going your way. Work forwards and consider the consequences of your behavior to yourself, your team, and your organization. What was the cost of that behavior? Then work backwards and try to identify the link in the events, the starting point, or the trigger that may have caused your behavior. Can you see it? Can you see the cascade of links from the event to your behavior? If you can impact that event or the events, you have a good starting point to change your behavior. If you've enjoyed this episode, please consider subscribing and leaving us a review. Feedback is a gift, and we love gifts. Thank you for listening. I hope you'll join us again next time.